we need to maintain health in general, starting from very young. And we have shown that what we call obese kids, kids that weigh too much, do start to develop this disease much quicker than the average person. And the risk factors include, if you smoke, you have 3 to 5 times risk of a heart attack. What they're really talking about is that cigarettes damage your arteries. Whether it's heart attack or whether it's stroke, it doesn't really matter. It's the same disease. Even kidneys are affected. Exercise is obviously important, and a risk factor is lack of exercise. Another risk factor, for instance, is obesity. People have gained weight. The average weight of the public is steadily going up. And with that, we have problems that we call insulin resistance. This is certain hormone irregularities that occur with this growth of the body. And this insulin resistance then causes the arteries to become damaged at a faster rate. It also drives up blood pressure, which is another risk factor. And blood pressure also has evolved through the last 5 to 10 years. We used to say that your blood pressure is fine if you got it down to 140/90. Now we say that's not good enough. We need to go down to 130/70. What we're finding as we go is the lower the better. It's not just about reaching the minimum, but if your blood pressure is much lower, you're at much lower risk for artery disease. There are other risk factors. One that's very interesting now is alcohol consumption. We found that people that drink 1 glass of wine a day, or 1 beer a day, or 1 even hard alcohol, one ounce of hard alcohol, they have less artery disease. Drinking in excess obviously makes things worse. We're not condoning that at all. The diet is very important. We always talk about cutting back on saturated fat. We talk about cutting back on cholesterol. And now we're finding it's very important to go back to basics. Fruits and vegetables, very important. We find that that lowers your risk. The 9 basic risk factors account for 90% of all risk for your first heart attack. 90% of your risk. And these are things that we've known about for years, but what's exciting, what's interesting, what's driving us now is we're finding out that not only do we know about the risk factors, but they make a huge difference. And that's what we need the public to know to drive them to do these things. That's what we need the doctors to know to aggressively treat patients and aggressively educate them. And perhaps education is the best medicine, perhaps not a pill.